my name is Candace Barnhart-Johnson and I'm your TA for the kinesiology taping course. And in this video, I'm going to give you a demonstration of an evaluation that you would do prior to doing any kind of taping. So this is Skye. She is my 8-year-old Egyptian mare. She's a Frisian Gypsy Cob cross, or Irish Cob if you're in the UK. She is 15 hands. She's about 1,300 pounds. She's green, and about the only thing that we deal with her is posture problems. Part of that is due to lack of fitness, due to lack of work, and then part of that is also because she was bred at a young age. She was bred as a 3-year-old, foaled out as a 4-year-old, and she had dealt with chronic laminitis at the time, and then not long after she foaled out, she experienced a freak injury to her stifle where she hyperextended the stifle. So those are about the only areas that I work on with her and that I'm concerned about. Now, keep in mind, I'm going to be doing the first part of the evaluation here, the gait analysis or the gait assessment, at Liberty, because it's my preference and because I want to see the horse completely uninhibited and unencumbered by a line, by a halter, by any of that. I want to see how she moves, how she responds, how she interacts with her environment. If you need to put the horse on lunge line, or that's what you would prefer to do, please do that. Do what works for you, do what works for the horse. This just happens to work for me. And that way you'll also be able to see how she moves naturally. That being said, Skye's not the most forward horse, and so to get her to move more forward, she has a tendency to lose her posture. More than likely you will see that at the trot. If I can get her to canter, we'll probably see it at the canter. You may or may not see it at the walk. I don't anticipate to see any kind of loss of propulsion or range of motion in her, because again, she's 8 years old, she does not have arthritis, and she doesn't have any known problems. So I'm going to go ahead and get into the gait assessment, and then we're going to go into more of the hands-on stuff here once we're done with that. All right, let's see if we can get Skye to move off. Come on, baby. So right off the bat, she did a really nice little pivot. Didn't struggle with that at all. Very interested in where I'm heading. Now, I do have toys out here, and while some people might think there's a problem with that, I personally like it because it gives the horse an opportunity to experiment with range of motion, and experiment with how they use their body. So first thing I'm going to look at is Skye, due to her breed, is a naturally high head carriage type of horse. So I'm not going to look at her higher head carriage as any sign of tension, because for her, it usually isn't. So what I'm going to look at to determine that is the relationship between her poll to her wither and her chest. And it's a little bit harder to see on this side because of her mane. So I'm going to ask if she changed direction. So on this side, you should be able to see it a little more clearly. I'm looking at the relationship between her poll, her wither, and her chest. Is she pulling herself along, or is she striding along? Are the muscles underneath of her cervical spine bulging, or are they nice and smooth? Does she have an open throat latch? If any of those things appear tight, then there's tension in the neck. I'm also looking at, is she bobbing up or is she bobbing down? So if her nose is bobbing down, she's using her full range of motion through her neck, her shoulders, her back. If she was bobbing up, that would be a sign of tension. Girl. So what I'm going to look at right now is how she's using her legs. So is she striding the hind foot tracking up to where the front foot left off? How far is it tracking? Is she clipping herself? I'm going to look at the relationship of her knee to her hop. Is she using her full range of motion in her hop? Or is she just kind of dragging herself along? Now she offered to trot, so I'm going to assess the trot here. Now Skye has more of a jog unless she's being asked to really extend out. She's showing beautiful range of motion through her shoulder and through her front legs. Like I said, toys gives me an opportunity to see things that I wouldn't necessarily see if the arena was completely empty. So, what I'm going to ask her to do here is trot for me. Same thing, Skye carries herself a bit higher than the average horse. So, okay, so now there's some tension there in here. Girl. So I'm going to ask that she trot out for me. Now what I'm going to look for here is how is she using her hind end? Is she driving up underneath of her? Is she using her stifle? Is she using her hocks? If she goes over those poles, how does she go over the poles? Girl. So she's lifting her head again. I'm not going to automatically look at that as tension because it could be confusion. Girl. Okay, so the more that she's trotting forward, the more she is lifting her back and engaging. But it doesn't look as good as it could. And some of that could be confusion. Some of that could be just, uncertainty. She doesn't really know what the point is of all of this. Good girl. Now I'm going to see if I can get her to canter. Come on. So you can see she actually really drove from her rear end, which is great, but her head went very high. So, could be a sign of tension in her back and in her hind end, or it could be just, again, an emotional response to confusion as far as what she's supposed to be doing. Good girl. All right. Well, like I said before, Skye's not a naturally forward horse, so getting her to canter might be a challenge. Come on. Come on. Okay. Beautiful trot. Let's try this direction. There we go, there we go. Very short-lived. Again, she's not a forward horse. So getting a really good canter is sometimes hard. So there's a lot of, you can see a lot of tension in her back because she's lifting her head higher than it really can go for her balance. You might be able to see some of the tension in her rib cage too, to her abdominals. Lots of drop, lots of tension for But I'm gonna call that emotional and not physical. Again, I know my mare, and I know that that is what's going on with her, is more of a physical or more of a mental and emotional tension, lack of wanting to go forward because of confusion, rather than physical restriction. So I'm going to go ahead and go into the more hands-on part of the demonstration. Now, for the purposes of this portion of the demonstration, I'm going to put her halter back on as a safety net. Generally, I do most things with my horses at liberty, but I'm very well aware that not everybody's comfortable with that. So I'm going to ask, does she hang out with me with the halter?
Hey, buddy.
So what are some things that we want to do for a hands-on evaluation? So first off, I want to look at her skull. I want to see if there's any asymmetry, if there's anything popping out to me, standing out to me immediately that's not normal, or for lack of a better way of putting it, abnormal. We've got a lot of forelock right here. So I'm going to look at her eyes. She's not weepy, there's no puffiness, there's no cloudiness. If I was to lift here, her mucous membranes are not red. She's got nice, healthy, clear eyes. Nothing particularly to note. She doesn't have overdeveloped muscles here at the frontal bone and a parietal bone. And put a little bit of pressure on her TMJ and there's no reaction. I can draw down here on her cheekbone. Again, no reaction from cranial nerves. I can do the same thing here at the front. Down her nostril, no reaction. I'm going to put a little bit of pressure on her nasal bone. There's no puffiness. I can't hear any rattling or roaring, so there's nothing going on, at least initially, respiratory wise. And she did quite a bit of movement. She's not breathing very heavy either, so that's a good sign. I'm going to come down here to her molars and put a little pressure on her molars and see if there's a reaction. No reaction. So I'm going to look at her mouth, look at her teeth, the set of her jaw. And what I'm looking for is if there's any kind of misalignment. Looking at her bite, does she have an overbite or an underbite? Does she have hooks? Anything that could cause tightness or tension in her head. And I'm also going to put my hands here and just see what her reaction is to that. And if there's any resistance or anything in particular to note. And I'm also going to put my finger here on her gum, and we're going to check capillary response time. It filled almost immediately, so that's good. And she's got nice pink gums and a nice pink tongue. So again, keep in mind, if it is not pink in any shade at all, period, there's something very, very wrong. Horses' gums should never be any color other than pink. If they're really, really faint white, gray, or even blue, that is a really huge problem, and a vet needs to be called in immediately. I'm also going to note just in general, her attitude. Is she interested in being here? Is she having a good time? Is she trying to get away from me? Is there anywhere she doesn't want me to touch? So, like, can I touch her ears? Can I touch around her eyes? Can I touch here, you know, on her nose? Is there anywhere that she's automatically like, absolutely, no, you cannot touch there? On a lot of horses, that is going to be the pole. Most horses do, or lots of horses, I should say, don't like this, and it's because they have pain or tension here at their pole, or at the axis, or atlas and axis vertebrae. So I'm going to take my middle finger and my thumb, and I'm going to put a little bit of pressure and see what she does. Now, Skye's been taught to drop her head with pole pressure, so as long as she's doing that, there shouldn't be anything wrong here. If her head was to like shoot skyward, that's an automatic, obvious response that there's something wrong here. But smaller signs could be just the face gets tight. See right now she's very, very loose in her muzzle. She's not holding any tension here at all. A horse that's pursing their lips or has a really, really tight muzzle could be a horse that's in pain. Some horses squint when they're in pain, a lot like people do. Flip her mane over here. So things I'm going to note on Skye, I'm going to keep in mind her breed and her type. She is a Baroque/Cobb type, which means that she has a relatively small head in relation to the rest of her body. And looking at her neck, I'm going to look for areas of overdevelopment and underdevelopment. So a horse that would be underdeveloped might have very large muscle development here and very underdeveloped muscles here. Skye has a natural crest. It's not because she's overweight. She is overweight, but it's not because she's overweight. But I'm going to palpate here and put pressure if there's any tension, tightness. If this is uncomfortable for her, she might tighten her muscles under my hands. Same thing here. If I run down here, can I feel any abnormal tension or tightness? So one thing to note when it comes to the normal tension of muscle is it's going to feel like there's substance and it's firm, but there's no, it shouldn't feel hard underneath of your hand. There should be a little bit of resistance, but almost like a dynamic and springy kind of feeling, almost like rubber. It should also not feel like jello either. So I want to feel that there's nice muscle tension here and there's no abnormal reaction. No abnormal reaction here in her chest, through her shoulder. This guy's got a very, very kind of almost somewhere between upright and laid back kind of shoulder. No abnormal response in the muscles here. I'll work my way back to her wither. A good point to palpate is the back of the shoulder. Now, Skye is not a ridden horse currently, so I wouldn't expect her to have any pressure points or areas of pain in her shoulder or in her back, but if she did, this is how I would look for it. So there is cartilage at the back of scapula. A horse that is ridden in a saddle that's too small can damage this, and it can be very painful to have this palpated. Now, like I said, Skye is not a ridden horse much yet, so there shouldn't be any areas of tension through this area or through her back. Now, a note as far as the pressure that I'm using enough pressure to feel bone, but not so much that it would harm her, I guess is the best way to explain that. So if you were to, on your arm, push to where you can feel the bone, but not so much that it's uncomfortable, the pressure is uncomfortable for you. So I'm going to take, again, my thumb and my middle finger, and I'm going to go on both sides of her spine, and I'm going to start here at the wither and run slowly down and see if there's any reaction. And like I said on Skye, there shouldn't be, unless she was to have pulled something or hurt something. Alternatively, I can take my middle finger and just run it down the spine. On this side, run my fingers down her ribs, see if she pulls away or, you know, in what other way contorts herself. Same thing, I'm gonna run my hand on her girth, see if there's any pain response there. But she's super interested in what's going on in the corner over there, so chances are there's nothing nothing going on here.
Being the baby.
So
being the baby.
Yeah, being the baby. My son's over there. So here at her lumbar, her sacrum, checking to make sure that there's nice consistent muscle tension. Here at the point of the pelvis, down at her stifle. Now this is the stifle that she injured. So what I can do is take my whole hand, wrap it around her stifle, and put a little bit of pressure on that joint. Now the only thing that I feel is her moving that joint underneath of me, but she's not really reacting to it, she's not pulling away. And there's no abnormal puffiness, knots or anything around that joint. She's not responding to anything that I do. So I'm gonna go ahead and go to the other side. Oh, I'm sorry. I'm gonna check the back of her leg here for any abnormal tension. There's a little bit of tightness here. And essentially what that feels like is it's just the muscle is much firmer than everything else around it. But it also could have been the way she was standing.
Good, she's leaning.
Okay. I'm gonna go on this side. We're gonna check her on this side. Same thing. Move all this hair. So I'm gonna look at her neck. Do I see any obvious signs of tension? Is there any overdeveloped muscle here, underdeveloped muscle here? This guy's very healthy and usually carries herself in a very healthy manner. So she's not underdeveloped or overdeveloped here at all. These are all nicely developed muscles, and it runs smoothly into her shoulder. So no abrupt, like super thin neck and then all of a sudden there's a massive shoulder blade. She doesn't have any muscle wastage or atrophy behind her shoulder, but I can clearly tell where that shoulder is. Same thing down here. No obvious pain or tension anywhere. Run my hands down, see if she reacts in any weird way. Now she's got a weird scar here. So, if I was going to tape her, I might choose to tape this area to help remodel the scar tissue here. I'm going to go down her back, see if there's any response there. Same thing here. Now, one thing I am noting is that in relation to the opposite stifle, that stifle, or her left stifle, had a little bit more of a fleshy kind of feel to this stifle. So that means that she does have a little bit of swelling on that side. And because I know that she did have an injury, I'm gonna note that. Granted, her injury was a couple of years ago, but it could be that she deals with a little bit of discomfort there from time to time. I'm going to check her semitendinosus and semimembranosus muscles. Also a little tighter than the rest of her muscles compared to everything else. Okay. So last thing that I'm going to do is I'm going to look at her legs and her range of motion in her legs. and also look at her range of motion in her neck. So one way that I can do that is I'm going to pretend I have a cookie, I'm going to offer her the cookie, and see how far she's willing to reach back. I want her to at least be able to reach her flank. If she can reach her flank, great. If she can't, then there is tight muscles through the back that I wasn't able to palpate. It could just mean that she needs more flexibility training. But if I notice that she's having a difficult time or there's muscle spasms through her back as I'm asking her to do that, there's a very good likelihood that I need to focus on her back. All right, go this side. I'm going to do the same thing. I'm going to pretend I have a cookie. Or, you know, if your horse is smart like mine, you could actually get a real cookie. I'm going to pretend I have something for her. And I want to see how far she's willing to reach. Good girl. And she can reach back to her flank, no problem. Good girl. Okay. Another thing that you could ask them to do is put their head down here. If they can reach all the way, like chin to the bottom of their chest or to their sternum. A horse that has something going on with their back might not be able to do that. So the next thing I'm going to do is look at her range of motion and her legs. So before I ask her to pick them up, I want her to be as square as possible. So that's a polite way to ask her to pick up her feet. And there's a much better chance of her doing this without falling over and giving me a false evaluation. I'm going to ask that she pick up her foot. And I'm going to compress that knee, see if I can get her heel to her elbow, and if there's any resistance there. So for her, there was no resistance. And I'm going to take and rotate her fetlock, see if there's any resistance, any kind of, cracking or things that I shouldn't hear. And I'm going to ask that she reach forward and see if she's got full range of motion. Now I'm not pulling on her, I'm just seeing how far she's willing to stretch. I'm not going to lift and pull on her leg. And then I'm going to put it down, crossing, as a neurological test. I'm going to do the same thing with this leg. Compress that knee. See if I can get her heel to her elbow. I have no problem doing that. And at the knee, at the fetlock. No hesitation or resistance. And I'm going to ask that she stretch out. Now, one thing I'm going to note is that Skye has a little bit of a knot on her knee, which could have been from an injury when she was younger, but it doesn't cause her any lameness. It's just kind of an odd looking blemish. So I'm going to ask that she pick up her hind legs now, and I'm going to extend them back, and basically just give her support and see how far she's willing to extend back. Lift up a little bit if there's any tension, note that. I'm going to compress her hop and her stifle. See if there's any resistance or if it's difficult for her to stand. And then I'm going to rotate that forward and see if there's any resistance. So there's a little bit of resistance this way, which could be just lack of flexibility. But if you didn't have a difficult time standing, ask that she pick this up. I'm also going to note how willing they are to pick up their foot. And if that is like a defiance out of lack of training or lack of assuredness, confidence, or if that is because it hurts. So if it hurts to pick up their hind leg, you're gonna know that because they're gonna refuse to pick it up. And it's not gonna be like a violent sort of thing, it's just they don't wanna pick it up. So same thing here, I'm gonna extend this, or I'm sorry, compress this. See if there's any resistance. Reach it forward. Now, what's interesting is she's got much more range of motion on this leg than the opposite leg, which would be consistent with an injury to her stifle. So what that could mean for Skye is that she just has tighter tendons, ligaments, soft tissue surrounding the stifle. And knowing her history, that's probably what it is. So to tape her, I could go ahead and tape her stifle for support and see what that does for her. I could tape that scar on this side. Other things that I could do for her would be to tape her thoracic sling, which is this group of muscles here that hold the shoulder onto the body, to help improve her posture. And I could also tape her back down over her haunches down to her hocks to help improve her posture as well. Or another option would be to tape her abdominal muscles. So there you go, that is a evaluation for KTape.